Welcome to the Pediatric Playbook, where we guide growth in children and balance in ourselves. I'm Amanda, a pediatric occupational therapist, here to share stories, strategies, and insights to support parents, therapists, teachers, and caregivers as we navigate the ever-evolving world of child development together. From tackling potty training and sensory needs to celebrating milestones, this podcast is your go-to resource for practical advice, inspiring stories, and honest conversations. Each week, we'll explore topics that matter to you, whether you're a parent looking for answers or a pediatric OT, SLP, PT, or educator searching for fresh perspectives. I'll also sit down with other therapists and professionals to dive into their unique journeys and the lessons they've learned along the way. So grab your coffee, settle in, and let's dive into this journey together. Whether you're here for personal growth, professional insights, or a little bit of both, I am so glad you're here. Welcome back to the Pediatric Playbook. I'm Amanda, and today's episode is one that you aren't going to want to miss. If you've ever found yourself wondering, should I take my child to the ER for this, or felt just completely overwhelmed in any kind of a medical emergency, this conversation is definitely for you. Joining me today, I have my friend Miranda Dunlap. She is a pediatric ER registered nurse who has seen it all over the last 6 months. She's freshly new to the scene of the pediatric ER, so it's really exciting. Lots of fevers, injuries, all the worried faces of parents just trying to make the right call for their little ones. And in this episode, she's going to share what really happens behind the scenes, most common reasons kids might end up there, how to know when it's time to go. Plus, we'll talk about how medical teams really do support children through some of these traumatic experiences and what parents can really do to make those ER visits less stressful, and even some of the biggest myths and misconceptions about emergency care. So whether you're a parent, therapist, or healthcare professional, you're going to walk away from this episode with so much practical insight and just a new appreciation for the fast-paced world of pediatric emergency medicine. So let's get into it. Miranda, I'm so excited for you to be here today.
Thank you. I'm happy to be here. I'm working on getting my voice back, so you have to forgive me if I get a little raspy.
I was just telling her I love a raspy voice, so I'm excited for this. Miranda is in town visiting this weekend. Our significant others work together. They're actually like DJ MCs for a local college, which is just fun. Today is their last game, so I was like, Miranda, you need to be on my podcast. So here we are, backyard scene, all the setup, my first ever like in-person friend interview. So I'm just super excited.
Yeah.
Okay. Also, I kind of just wanted you to introduce yourself a little bit.
Yeah.
I know I mentioned that you're a pediatric ER registered nurse, but tell us a little bit about your journey of getting to become a pediatric ER nurse and kind of what a typical day looks like for you.
Yeah. So I graduated nursing school in December of 2023. And initially I went into some outpatient dermatology work where we did surgical removal of like carcinomas, melanoma, squamous cell, things like that. And I really enjoyed it, but I had always wanted to be in the pediatric world and at the bedside in the hospital. And so this opportunity finally presented itself to me. I was able to interview, and the rest was history. So I've been doing this almost 6 months now, and I definitely have seen a lot. It certainly, there are way more seasoned and experienced people out there above me, but just in my short time, I feel like I have such a newfound appreciation for pediatric in the world of emergency medicine.
It's amazing. And honestly, everyone starts somewhere.
Yes.
And it's crazy that you got in so fast too from getting to your career. I feel like this is kind of a tough job position to apply for and get. So
yeah,
must have been meant for you.
Oh, thank you.
I love it. Okay, so what does a typical shift look like for you now in the ER?
Every single shift is different. Like truly, I don't think I've had 2 shifts that are like. Sometimes you come in, I work 3 p.m. to 3 a.m., which is kind of a mid shift and a very strange hours. So I can come in the middle of the day and it is just a zoo. Like we are full, the waiting room is full, and everybody's running around like crazy. And then I can also come in to an almost empty pediatric ER sometimes. Like there's truly just no telling.
Is there a way to like prepare yourself mentally before you go into this day, or do you just go in literally not knowing what is going to happen?
I really never know, but I just go in planning that it's going to be chaotic and ready to embrace the chaos. And then if it's a little bit more calm, then great. And if it's not, I'm already ready.
Were
So
you always a night person?
yeah, I definitely think I'm more of a night shifter at heart. I don't mind the 3 p to 3 a shifts. I think I'm a little more partial to working 7 p.m. to 7 a.m. But I there's something about the sun going down that brings out some of the crazy and the chaos, and I just kind of live for it.
Wait, I love this. I am the complete opposite. I literally am up at 6 a.m. every
Mhm.
day, and at 3 p.m., I am ready to be on my couch
Yeah.
taking a nap. So I have so much appreciation. And I know when I have a child one day,
Mhm.
if I need to be in the ER at 2 a.m., I hope that you are the person that I have there because you have it all together. All right, so let's dive into like what are the most common reasons that you're currently seeing kids come
Mhm.
into the ER for?
Right now, we're kind of coming off of the end of hopefully flu season. Once it starts to get a little warmer, it tends to lessen up. But right now, it's respiratory issues. Kids that are coming in with shortness of breath, stridor, where basically they have the swelling in the airway, so they start making this barking sound, almost like a seal. And just kids that are just needing a little extra help. So sometimes we have to admit them and have them on oxygen for a couple of days while they recoup, things like that.
Wow.
Mhm.
Is there, is that barking noise? Is that
Mhm.
something that parents should be bringing their kids to the ER for?
Absolutely. Yeah.
Okay.
You will notice, we call it strider or strider at rest. It's just it's almost barking is the best way to describe it. You'll know it when you hear it, and we may even be able to like figure out a little clip or something. I don't know.
Yeah.
Um, but
Yeah, maybe I can try to figure out how to put a clip in here.
yeah,
If I do, that would
but
be amazing.
you will know because your kid is working really hard. They're breathing very fast. And typically it happens like they wake up with this noise going on.
Okay.
So that happens. So really just
Yeah.
respiratory based stuff right now.
Okay. And what are some symptoms or signs that should always prompt a trip to the ER, kind of building off of that?
For sure. Again, if we're talking mostly respiratory, any sort of very fast paced breathing that's not alleviated, if you're noticing that they're making a strange noise, in this case we've mentioned the barking, or having a really croupy cough where it just sounds very like wet
Hmm.
and productive. I know that might sound a little gross. Um, or if another thing that we look for is called retractions. So if you look at their chest and you notice that there's pulling like
Mm,
in their rib cage, in their sternum, especially if it gets up in here
mm.
and you see them pulling really hard with each breath or flaring in the nose, that's another sign that they're working very hard to breathe
Okay.
and it could benefit from some emergency care.
Yeah. What
Hmm.
about fevers? Like, what is the
Hmm.
number on the thermometer that parents should be looking out for?
For sure. Especially in neonates and babies, 100.4
Okay.
and above is a fever. If you are a baby, we shouldn't be seeing fevers in you at all.
Mm,
Especially if you're 28 days and under, that's like really uh, something that you would want to seek care for.
yeah.
And then as well, that's another common misconception that we sometimes see is parents won't treat the fever before coming into the ER because they're
Mm,
worried that they won't be believed. Like, oh, my kid's fever was 103.2. It's okay to treat the fever
okay.
before you come. Throw some Tylenol or Motrin in and then bring them to us. We believe you if you show up and we take their temperature and it's 98.7 and it was 103 an hour ago. We believe you. We want you to treat your child and we can go from there.
That's so good to know. I
Hmm.
know so many parents will I
Hmm.
honestly said that to me in my occupational therapy
Hmm.
sessions, like, well, I don't want to give them Tylenol because we have to go to the doctor this afternoon for a check-in. And I'm
Yeah.
like, "Ah," and I also didn't know. I was like,
Right.
I guess you're right. Like maybe they won't
Hmm.
know if they have a fever or not if you're
At
treating
least
it.
where I work, we believe you. If you say your baby had a fever or your child had a fever before you came in, we would rather them be afebrile when we get to them than burning up and going down a scary road
Okay. That's really good advice.
for sure.
So, are there some common cases where parents bring their child in but could have managed it at home or through an urgent care center versus an emergency room?
Yeah, there definitely are, and I think some of that, the semantics of it is timing. So if it's in the middle of the night, you don't always have access to urgent care,
Mhm.
right? And there's also sometimes just an educational standpoint. But my rule of thumb is truly, I would rather you be safe than sorry.
Yeah.
And there are moments where we're like, okay, yeah, this probably could have been an urgent care visit, but I trust parents' gut. You know, if a mom tells me I just don't feel right about something, the
Mhm.
first thing I want to do is lock in with that parent and, okay, let's go down this road. Let's figure out what it is that has brought you in today that you feel like couldn't wait.
Yeah.
And sometimes it really is just a matter of education and reassurance. Another thing that we see a lot is like dehydration in little
Hmm.
ones. Less than 3 urine outputs or like wet diapers
Mm.
in 24 hours can be a sign of dehydration. Um, the number three also for like diarrhea occurrences in a 24-hour period. If they're having that many or more,
Hmm.
that could be a sign of dehydration. So maybe they need to come in and get IV fluids. But if they're getting that good like hydration and input and having good output, then that's typically something that can wait.
Okay. That's so good to know.
Mm.
And how do you handle those like high stress situations when there is something extremely emergent and urgent coming in with those critically ill
Hmm.
or injured children rushing through your doors?
Yeah. Our team, like teamwork is the biggest thing. I rely on my coworkers just as much as they rely on me, and communication is the biggest thing. And just trusting that the person that's beside me knows what they're doing and is there. We're working all as a cohesive team.
Yeah.
Hmm.
I feel like that's got to be so important. I always think about whenever I'm referring a kid, not necessarily in the emergency room, but I'm like, okay, let's make sure the pediatrician knows what's going on and
Hmm.
then the GI doctor knows what's going on, and everyone has to collaborate together in order to have these good outcomes
Yeah.
for kids. And I can only imagine in an emergency
Yeah.
situation, like everyone's got to have their head on their shoulders right and like
Hmm.
be fully focused in on what's going on.
Exactly.
Do you feel like you see a lot of injuries, like really emergent injuries coming in, or is it more respiratory and illnesses?
We see a lot of different stuff. We're a level two trauma. We're working on becoming a level one trauma
Ooh.
facility for pediatrics, but we're level one for adults and level two for peds.
Okay. If you're like the highest level hospital,
Hmm.
then you guys know where you can send
We
patients
have all
that
of our
need.
experts right
Okay.
there in a hospital.
Yeah.
So we're working on that. I guess going back to like injuries, I mean, I've been in a pediatric situation where we have gunshot wounds, where we have NATs, like non-accidental trauma that occurs with kids, which is very, very unfortunate and devastating. And that's where DSS and law enforcement gets involved. I've seen broken bones, I've seen car wrecks, I've seen injuries from falls, trampolines. My child will never. We won't. They might jump on a trampoline, but I will not have one in my backyard. I just seen too many broken femurs from that. Just like things, just all sorts of things. Truly.
Yeah. I feel like the trampoline statement is consistent across the board of like any healthcare
I
provider on the
know.
internet, any doctor that is like in urgent care or anywhere always says like say no to
Say
trampolines.
no
And
to trampoline.
it's crazy because as OTs, any OTs that are listening, also like for our sensory seekers out there, we're
Hmm.
always recommending like get a trampoline,
Yeah.
like get their
Low
jumps
to the
and their
ground. Low to the ground.
okay,
Yeah.
that's what I was gonna ask. Like, do you feel like those small individual children's trampolines that go inside that just have like a handlebar on them for kids that are like of appropriate developmental age could use those safely, or are
Absolutely.
those okay?
I think I would prefer those over anything else. I
Okay,
think especially, and you said with the handlebars, 10 out of 10. Handlebars engaged, jump away to your heart's content,
okay.
like work those muscles out, all the good things. What I really tend to see is like you think those big round backyard
Hmm.
trampolines that you have to like just jump up on just to get into. And then those are the kids that are jumping and jumping and like falling through the net or falling through the trampoline onto the ground and then coming to see me.
Yes,
Yeah.
or like the trampoline parks. I like think trampoline parks are so fun, but I'm also like, okay, I can see where this can be extremely dangerous. I'm lucky to have made it out, without any injuries from
Hmm.
all the times that I went. But now, like hindsight, looking back, and I'm like, okay, trampoline parks are probably not the safest
Yeah.
place to be.
Yeah, had a couple kids come from there too. So,
Yes. Okay, I want to switch gears slightly about how parents can advocate for their kids effectively when they're there
mhm,
with them in the ER.
absolutely.
What do you feel like? How can parents best approach this if they, one, are feeling unheard,
Hmm.
or two, they're just having like maybe their child has some kind of special, unique needs, sensory
Hmm.
needs? What do you feel like is the best route for parents to go to advocate to make sure that their child is fully understood when walking into those emergent
For
situations?
sure. The biggest thing is to communicate and speak up, and I know that can be very hard depending on the circumstance that has brought you into the emergency room. Like sometimes when we get a kid, just depending on their acuity and how critical they are,
Hmm.
we don't necessarily have the time to fully delve into your background of like all your diagnoses and what basically makes you who you are now.
Yeah,
Sometimes all we know is like this child came in unresponsive, they're not breathing, that's it,
yeah.
right? And then we're focused on those core things. So the biggest thing is don't be afraid to say, hey, my child has this need or this sensory thing,
Mhm.
or don't be afraid to say that my child has these sensory needs, or if in the right situation and context, of course. But I've had a parent where their child was not like officially diagnosed with
Mm.
any sort of anything, but you could tell they were not neurotypical, and they were dealing with some sensory issues. And so we had to unfortunately place an IV in this child. They ended up being fine. They needed just like labs and fluids, all the things, but they really struggled with sticky things. Like, so
Mm.
our band-aids and our stickers and our wraps. And so we were trying our best to adapt to that child's needs. And so instead of using sticky stuff and we could avoid, we would wrap with
Mm.
cotton things.
Yeah.
And that way he wasn't having to deal with getting tape off and like having that restriction and like that sensory issue that they really, really did not tolerate well.
Yeah. Wait, that's so great and such a little thing that you don't even think
Mhm.
about, like those sticky textures and
Right.
things being caught and
Yep.
sticking to their skin, like,
Mhm.
but it takes a unique lens. And I feel like that's where,
Mhm.
the differentiation between working with adults and pediatrics
Right.
in hospitals, in clinics,
Mhm.
and when you're a therapist or a nurse and you're going into these different fields, there's just different areas of consideration
Right.
that you might not think about. And then once you get in the job, you're like, oh my gosh, okay,
Mhm.
maybe now the next time you see a kiddo come in, it's something you might even initiate asking too,
Right.
because now you're like, okay, there might be
Mhm.
other kids that deal and struggle with this
Right,
too.
right. Yeah, or do they have their own preferences? Like down to, sometimes when we have these procedures, we do comfort holds where the parent will hold their little one in a specific way that is safe for the child and safe for me as the nurse as well, and comforting rather than being just like held down forcefully. Like that is never ever the goal and never something that we do.
Yeah.
And there's certain specific ways to do things like
Yeah.
that for that
Wait,
reason.
that's amazing.
Hmm.
Are there any other like techniques or strategies you use to reduce anxiety and for the
Hmm.
parents too?
Yeah,
Like I know
no, 100%.
sometimes the parents are way more anxious
Right.
and nervous than the
And I
children.
and I think and I try my best to engage with both parents and kids. Like obviously I'm there for the kids and I'm like communicating with the parents, but so often the parents forget to take care of themselves too in these situations because they're so focused on their kids. And so like to manage anxieties and things, like once like my signature thing to do is like make a room cozier. So
Mm.
if like once we're done with all of the scary things and all the hands-on things, if we're just like in the in between when we're waiting on lab results and we're just making sure you're stable, I like to turn lights down, turn on like a little night light so it's
Mm.
like cozy movie night vibes, and put on a Disney movie. And like we have sound machines we can bring in,
Yeah.
and warm blankets and snacks if they're able to eat. So just little things like that just to try and make something that could be a lot less stressful, or
Mhm.
something that could be stressful a lot less.
Yeah. Ah, that is so special. And I know there's so many parents out there that feel comforted knowing, okay, they know and they
Hmm.
understand our unique needs and
Hmm.
anxieties, and they are here to support you guys as all healthcare providers are. And if you're feeling anxious and nervous, don't be afraid to speak up and let them know,
Yeah.
like, hey, me and my
Hmm.
child are feeling like all out of
Yeah,
sorts.
100%.
Sometimes I think we get in fast paced mode
Hmm.
as, healthcare providers. And I'm
For
sure
sure.
it's even more in emergent care situations where you're like, all
Hmm.
right, we've got to focus on getting this child better and home and safe. So sometimes just giving your nurse or your healthcare provider that reminder of like, hey, can we like slow down a second?
Yeah.
It like helps bring us back to life and be like,
Hmm.
oh yeah, you're right.
And
Sorry.
don't be afraid to say it. Like there's always like a nice versus a negative way to say things. But if a parent says, "Hey, hold on, I need a second. Can you explain this to me?" Like absolutely, that's my cue to take a moment. And sometimes I'm going a mile a minute because for me this is something that I see every day. It makes sense. I'm explaining it. But if I'm not, if you're ever like you need that pause, you need that break, it is okay to say it.
Yep.
It's okay to say it. And I always like at the end of everything is like, do you have any questions? Do you have any concerns, or is there anything important that we haven't already talked about or that you want me to know?
Yeah.
You know, don't be afraid to speak up.
Yeah, I love that. And something we were talking about before we got into this
Hmm.
conversation live, we were talking about child life specialists,
Hmm.
and it's something that I haven't really heard a ton about. So can you explain what role that they play
Yeah.
in the ER setting?
Yeah. So child life specialists are they're to my knowledge, they're not always in every pediatric
Hmm.
emergency room. We are very, very lucky to have several on staff where I work. And they are licensed professionals, and they have the ability to meet a child where they are in their developmental level and their developmental age, and explain things to them as either as they're happening or before they happen. It's our goal is always before to have that conversation with the child. That way that they have an understanding of what's going on, and we are able to give them choices throughout where
Yeah.
we can. Sometimes, again, in a critical situation, if we're getting like a trauma in that's a pediatric trauma, they're the ones at the ear of the little one that are saying, "My name is Miranda. I'm a child life specialist. Okay, you're gonna feel this. Okay, there's gonna be some cold soap. Okay, there's a rubber band that's
Mhm.
tight. It's gonna be on your arm. There's gonna be a little poke on 3, 2, 1." And so they're guiding them through, so they're not just being ignored and like having 1,000 things being done
Yeah.
and making the situation a little less scary.
They're like the calm to the storm.
100%. They explain procedures. They have like distraction methods and toys and just ways of explaining things that is so incredible. I
Yeah.
think they're such like priceless individuals to have, especially in emergency settings.
Yeah, that's so amazing. And it's
Hmm.
a profession that I've never heard about. So,
Hmm.
also, anyone listening that's like trying to decide what area of healthcare they want to go in or they want to
Hmm.
help individuals, it's something to look into because I feel like that would be such a
Yeah.
rewarding profession
Yeah,
to be a part
and
of.
they do so much more than just pediatric setting, like emergency. They go into like labor and delivery, like there's unfortunately like stillborns. They
Yeah.
do like all the bereavement things with that. They are in the adult side, like if somebody has like young children and the
Mhm.
parent passes, they're the ones with the kids. Like
Yeah,
there's so much that goes into that.
that is
Hmm.
so special and so good to know.
Hmm.
Kind of going a little bit different route now.
Hmm.
Let's talk a little bit about social media. I know you are obviously on social media. I don't know,
Right.
you don't necessarily run a healthcare platform by any means, but what are your thoughts on social media and has it helped or harmed parents' understanding of when to seek care, like what to go about all of these different
Hmm.
things?
I think it's done both.
Yeah.
I think it has benefited us in so many ways, and I think there are also ways that it has like set us back. Um, Without getting like too political, like
Yeah.
there are parents that get a lot of their information from credible sources
Hmm.
on social media, and then there are parents that get information from people that don't have the licenses and the certifications that you or I might.
Yeah.
And so that can set their kids up for success or for danger down the road, depending on what their views are and the way that they go about
Yeah.
carrying those out.
I totally agree. And
Hmm.
I feel like that's kind of part of the scare of social
Hmm.
media, right? And it's also great because you now have access to free help and
Right.
information. And there's so many great nurses and doctors and therapists and stuff online that
Hmm.
are trying to just give free advice as much as
Right.
possible and talk about current cases and what's going on and what to look out for and signs and symptoms of different, respiratory illnesses
Right.
and things, which I think could be really great. But also just remember that if the person you're taking information from doesn't have any credentials, maybe just check in. Have they read research? Maybe they do
Hmm.
understand how
Right.
to read and process research without having credentials, and like that's
Hmm.
okay. But just take everything you read, even on Google, if it looks like it's coming from a
Hmm.
credible source, take it all with a grain of salt and always seek your own individual
For
care
sure.
from a provider who knows you, knows your child's medical
Hmm.
background. I mean, I feel like that's like the biggest takeaway when it comes
Yeah.
to care for anybody,
Hmm.
adults, but especially your child, get one-on-one
For sure.
attention.
Absolutely. And if you, for some reason, feel like your provider is not meeting your needs, whether that's your primary provider, it's okay to find somebody that meets those needs.
Yeah,
It's absolutely good. As long as you're getting the most informed care,
yeah.
that's always a.
Yeah. And I also feel like that too with our children that are struggling with some sensory challenges
Mhm.
or autism, those different things and finding providers that are up to date with the knowledge and how to best support your child. Obviously, in an emergent situation,
Right,
you
but
don't can't really pick and
mhm,
choose too much, but like have you noticed children, struggling in the ER that come in with autism or sensory processing?
absolutely. And part of our role in this is also to try and get the parents involved with like social work and
Hmm.
get them the things that they need.
Yeah.
Get them those resources, connect them with other groups and people that can help them in order to facilitate what's going to be the best environment for themselves and for their children.
Yeah. How do you feel like general healthcare
Mhm.
teams are handling like current day
Mhm.
kiddos that come in? Do you feel like people are starting to get better and more equipped in that area?
Absolutely.
Yeah.
Yeah. And again, I'm speaking mostly from the experience that I have with the staff that I work with,
Yeah.
but I would say that everybody is very, very well versed in like
Yeah.
how to approach those situations, how to help with de-escalation,
Mhm.
how to help like calm a room, especially if the environment is chaotic, which and where I work is almost always the case, so trying to create an environment where they feel safe,
Hmm.
they feel heard, and that the parents feel supported.
Yeah. How do you feel like pediatric OTs or speech therapists or other people
Mhm.
that are working with these kids day in and day out can help prepare kids for these future potential medical visits
Mhm.
to help reduce their overall stress? Like, is there anything I can be doing?
Right.
Especially now I'm going to be working in a school. So I'm like, okay, these kids are a little bit older. I'm
Mhm.
used to working with infants and toddlers. So maybe it's a little bit trickier, but now that I'm
Sure.
going to be working with kids ages like 4 to 12,
Mhm.
like, how can I help support them?
Definitely teaching them to communicate, and I know that's like harder or easier said than done,
Yeah.
but advocating for themselves, like not
Hmm.
being afraid to speak up.
Yeah.
I've had the smallest little kids that are able to say like this hurts or yes or no,
Hmm.
and like not be afraid to speak up in moments where I'm like, okay, hey,
Yeah.
I hear you, and understanding that sometimes when we're given a choice, like, okay, this is a sticker that's going to tell me like what your heart rate looks like and what
Hmm.
your oxygen looks like, but I'm allowing you a choice. It can go on this finger, or it can go on this finger,
Mm.
or it can go on a toe, and knowing that like when they're in those environments, they have choices, but not always. Like some things have to be done to keep us safe.
Yeah.
But they're always allowed to speak up and like advocate for themselves.
Yeah.
Hmm.
I love hearing that. And I'm sure that's so reassuring to
Hmm.
parents listening
For
too,
sure.
that their kid is going to have some choice in the matter and their voice
Hmm.
does
It
matter.
does. We always try. Like if there's a way to give a child a choice
Mhm.
and to make them feel like they're in control of a situation where they normally otherwise wouldn't be, we
Yeah.
want to give them as much control as we can without or while we can still give them the care that they need.
Yep.
If that makes sense.
Yeah,
Hmm.
exactly. And it's something I do, I feel like a lot with our kiddos,
Hmm.
especially the younger generations of
Hmm.
kids, as I'm preparing them for anything, when I'm helping a parent navigate how to help their child through potty training or teeth brushing or
Hmm.
whatever it may be. I love reading stories, watching YouTube
Hmm.
videos, and there's so much access to things now. Like
Right.
you can watch another kid. I'm sure there's tons of videos on the internet
Hmm.
of a kid going to their first doctor's visit or
Right.
even ER visits. I mean, maybe it's a little traumatic for a parent to be filming their child going
Sure.
to the
Yeah.
ER, but I'm sure it exists out there and
Yeah.
it's a way to prepare your kid, especially our kids that are really tangible and they like
Hmm.
to know like what exactly is it going to look like. You can
Hmm.
even do visits, I'm sure, to
Yeah.
local places and be like, okay,
Right.
here it is. Here's the doors. Here's what
Hmm.
it sounds like when we go inside. Like we're
Right.
just going to
And
walk into an ER, say hi to the desk people and walk back out. I mean, whatever
yeah.
it may be, if you know, like, okay, my child does not thrive in new settings, it
Hmm.
may be worth a visit one Saturday. Just
For
go and
sure.
enter these different places and see what's going on. I don't know how
Yeah.
you feel about that, but
Yeah. Well, and like they're sometimes they do sort of like allow, I wouldn't say maybe in the heart of the ER,
yeah, yeah,
just depending on the facility,
yeah,
but like it's nothing is gonna stop you from like rolling up at least and going to like the main
yep,
entrance, like not the emergency room
yeah,
entrance unless you need it, but like the main entrance, walk through like the gift shop and where the cafeteria is,
yeah,
but also like it's okay even if you're not planning ahead and like you're like, okay, we have to take our child to the ER, like saying, okay, friend, like this is what's gonna happen. We're gonna come here. They're gonna do some things called vital signs on you, where we say like the blood pressure cuff, gonna give your arm a hug, right?
yes,
Or we just have a sticker for your finger, and that's like our pulse ox.
yeah,
And like my special ears, that's my stethoscope, and no owies, nothing. Like we'll never surprise your child with something
yeah.
that's gonna be painful,
Yeah,
you
I
know.
like that idea of kind of taking them to the main hospital
Hmm.
entrance where they can see fun things
Hmm.
about the hospital too, like the gift shop, like you said, the
Right.
cafeteria, we can go get a
Hmm.
snack, whatever it may be to kind of help prepare them and letting kids know ahead of time, like, hey, if we ever have a really high fever or if anything
Hmm.
ever happens, like this is the place that will probably come.
Yeah,
And
and it's a safe
there's,
place. And that's
yeah,
the biggest thing is like this place is safe and this place is going to help us get better because sometimes you'll have like kids that unfortunately their parents weaponize
yeah,
medicine. And so it's like well, if you don't do this, then they're going to give you a shot.
yeah,
Or if you don't do this, they're going to they're going to hold you down and they're going to do it. And I'm
yeah,
like, no, we're not. Like,
yeah,
mm-mm. And you don't want them to have that fear.
yeah,
So, and sometimes even hospitals do events
yeah,
like where it's like you can bring your kids. Like I know we do them for Christmas where we have like, Santa comes and
yeah.
all the lights and we do all these things and we invite the community to come in. So that could be some great opportunity as well.
For sure.
Mhm.
Ah, that is so amazing. Okay, last little bit. Any advice that you have for new parents
Mhm.
when it might come to handling medical emergencies in general?
don't be afraid to ask questions.
Mm.
There are no like stupid or dumb questions. The only stupid questions are the ones that go unasked, is the best way to put it. Find a pediatrician that you love
Mhm.
and talk their ear off. Do your research, but don't Dr. Google yourself into a panic.
Mm.
And always, especially with little ones, when in doubt, bring them in.
Yeah.
Worst case, we get to love on your little baby for an hour or two and tell you that you did a great job, and to make sure that they're putting out wet diapers, and we give you a breath of fresh air and you go home.
Oh,
You know.
yeah. That is such a breath of fresh air to hear, I'm sure, for so many people that are nervous
Yeah.
when it comes to anything coming
Yeah,
up for their
for sure.
children. Okay, final words of wisdom for parents, professionals, caregivers. Last thoughts.
Be kind and give grace. If you are ever having to bring your child into an emergency setting, we don't want your child to be there any more than you want to be there, but our
Mhm.
job is always going to be to prioritize your child and keep them safe. But sometimes, and not to negate that your child may be super sick, we might have an even more sick kid next door.
Mhm.
And so if you're there first, just because you're there first, you're not always going back first. And that's not a bad thing.
Yeah.
You don't want to be taken right back to come see me, you know.
Yeah.
But I would just give grace, be kind,
Yeah.
and do your research.
Yeah, for sure. I love that. And you never know, like you said, what the person next to you
Mhm.
might be dealing with. So
For sure.
as even as healthcare providers, I think it's important for us to have these little gentle reminders
Mhm.
of like, yeah, we might have had a rough morning or have something
Mhm.
going on at home, but we can't always bring that into our work day.
Right.
And same thing as parents. I
Yeah.
mean, I can't even imagine, I'm not a parent yet, but those
Right.
sleepless nights and then something,
Yeah,
like a sickness or a
for
trauma is
sure.
going on. But yeah, always being kind and having grace
Mhm.
in any area that you can
Absolutely.
is great.
Yeah. And we're on your team.
Yes.
Yeah.
Oh, that's so important to know too. As a healthcare OT, I also am like, yes, we are always that person for you. And if I ever feel like your OT or your nurse or someone is not listening to you, just speak up. Like
Mhm.
we sometimes get out of tune and out of touch. Like we're all human beings, and sometimes we need just that like little gentle push.
Yeah.
Wow. Well, this has been such an amazing conversation. I hope this episode gave you a better understanding of what really happens in a pediatric ER and when you should go and how you can feel more confident in making some of those tough decisions when your child is sick or injured. Miranda's perspective as a true frontline healthcare worker is extremely valuable. I love how she just emphasized over and over the importance of advocating for your child, staying calm, and knowing when a trip to the ER is truly necessary or not. So, if you found this episode helpful, please take a moment to share it with a friend, a parent, a fellow healthcare professional who could benefit from it. Thank you so much for tuning in today. And Miranda, thank you so much for being here.
Thank you for having me.
It's been so fun. I appreciate all of you listening, and I can't wait to continue this journey with you. I'll see you next time on the Pediatric Playbook. I hope you enjoyed this week's conversation and found it helpful as you navigate along this journey, whether that's supporting kids, growing as a therapist, or both. If you're looking for more resources, tips, or support, be sure to check out my website linked in the show notes and connect with me on social media at Your Pediatric OT on Instagram, TikTok, YouTube, or wherever else you can find me. You'll find everything from free guides to in-depth courses designed to help you make an even bigger impact. Thank you so much for tuning in to the Pediatric Playbook. And if you enjoyed today's episode, please don't forget to subscribe, leave a review, and share it with a friend or colleague who'd love it too. I can't wait to see you next time, same place, same time, right here on the Pediatric Playbook.